I'd like to call to order this meeting of the First5 Sacramento Commission for Monday, August 1st, 2022. Madam Clerk, will you please call the roll and establish a quorum?
Chair Serna.
Here.
Commissioner Sneeringer is out. Commissioner Fernandez y Garcia.
Here.
Commissioner Gordon.
Here.
Commissioner Kasiri is also out. Commissioner Kathari.
Here.
Commissioner Wirtz.
Here.
Commissioner Kennedy's out. Commissioner Hassett is out. Commissioner Turner Johnson is out. Commissioner Evans.
Here.
Commissioner Gross is out. And Commissioner Callejas. Why can I not say that right now?
Here.
And Commissioner Moak is also out. With all of our vacancies, we're down to 5 voting members for this meeting.
Very good. Thank you. You want to read our statement, please?
Yes. This meeting of the First5 Sacramento Commission is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T Uverse cable systems. This meeting is closed captioned and live streamed at metro14live.saccounty.gov. Today's meeting will be repeated Wednesday, August 3rd at 9 a.m. on Channel 14. This meeting can also be viewed at youtube.com/metrocable14.
Great. Thank you. Will Commissioner Callejas please do us the honor of leading us in the pledge?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And with that, I do want to extend a special welcome to Michelle, who I've had the good fortune of working with during my tenure thus far on the Board of Supervisors. And Michelle is our director from Department of Family, Adult, and Children's Services. And we look forward to your contribution and service to this commission. I think your resume and your experience speak for itself when it comes to your dedication to all the things that First5 is responsible for, and the mission of this commission in terms of early learning and general child welfare. So I want to welcome you. All right. Do want to do a little housekeeping. I always said do that. It's because I do the house cleaning. All right, so at the request of Commissioner Wirtz, we are going to reverse the order of items 9 and 10. So we will hear the birth and beyond evaluation report before we go into the 2024 strategic plan, which I think is a good order exchange. So again, I want to welcome everyone that is here in person in chambers today with us, as well as those who may be watching remotely via Metro Cable 14. And with that, we'll go to our first item.
Item number 1, approval of May 2nd, 2022 draft action summary.
All right. Do any commissioners have any comments or suggested changes? If not, I'd entertain a motion.
So moved.
Okay, it's been moved by Commissioner Wirtz. Is there a second?
Second.
Second by Commissioner Gordon. Madam Clerk, do we have any people signed up to speak on this?
No, sir, we do not.
Okay, very good. With that, we have a motion and a second. Please vote.
Aye.
No,
Oh, on your
screen.
Sorry. Okay. Where display? There we go. Motion passes. Thank you.
Very good. Thank you. All right, now we're on to separate matters. The first item under separate matters is the public's opportunity to address the commission on any item that's not on our printed and published agenda. I don't see anyone approaching the podium, nor do I have speaker slips. Madam Clerk, I don't expect that we have anyone that's expressed interest in speaking off agenda. Okay. So, all right, with that, then we will move to item 3, which is our executive director's report.
Yes.
Good afternoon, everyone. It's a pleasure to be here and to see you all. I have just a couple things to highlight from the Executive Director's report. First is regarding our refugee funding. I'm delighted to share that we received funding from First5 California in the amount of a little over $570,000. And this is going to allow us to launch a new refugee family support program. We will be working with 5 agencies listed in your report to provide services from navigation, hotel vouchers, educational workshops and parenting workshops, mental health supports, and distribution of basic needs items like cribs, car seats, and other stuff. So we're really excited about this new project. Our launch date is October 1st. We're still working with the various agencies to bring on staff, get some navigator trainings up, and be able to launch. So it's a 12-month program right now, and we're waiting for confirmation from First5 California. We're really hopeful that we'll get an additional 2 years after this pilot year is over. I'm going to jump to the baby formula shortage. I'm sure you've all heard that there's been some struggles with local, statewide, and nationwide with families who needed infant formula, and that was due to one of our nation's major suppliers temporarily shutting down. But the good news is that our local WIC department, so just a huge shout out and thanks to Sacramento County WIC and Community Resource Project WIC, they both really worked overtime to get education and information to families about how to get formula. So I have included in your packet a fact sheet, just in case anybody that you know is experiencing this. I've heard it is definitely getting better. Things are on the upswing, but there's still good information out there for parents who need it. I will jump to another new program that we're just getting ready to launch. This is called Building Strong Families. You all had a vote on this at the last meeting. And we are doing some internal work right now with Michelle Callejas at Department of Child, Family, and Adult Services. We started last quarter just developing the program and sharing information out with the contractors. And this next quarter, we're really going to focus on finalizing our family needs assessment and the training plan for those navigators. I do expect there to be some crossover between the navigators from the refugee group and the navigators from Building Strong Families as far as trainings, because we'll have a total of 20 new navigators in the county. And so just sharing those training opportunities seems like a really good thing to do. And those navigators, again, are the Birth and Beyond resource centers, as well as the 7 community incubator lead sites. So we also have a small augmentation to the contract with ASR, our evaluators, who are helping us build out a results-based accountability evaluation for Building Strong Families, as well as the refugee program. A quick update on our racial equity work, along with April Jean, who's our lead consultant for our Ready work. We are just about ready to release a 1-year report on the Commission's internal look at our racial equity work, and that is coming out next week. We will have a presentation on the highlights of that report at our October retreat, because so much of the racial equity work will also be centered in our strategic planning efforts, and so that just seemed to be a really good synthesis. So April will be joining us in October to share that with you all. And we have a scope of work with her in place for this current fiscal year. We're going to do some staff workshops and focus on the implementation of our Ready Action Plan that the SOS committee and advisory committee has been working on over the last 6 months or so. And let me see. Oh, another, I'm just like, this is the meeting of new programs that are going to launch. So speaking of which, we have another program launching called Parent Leadership Training Institute, or PLTI. As part of our Ready work and our commitment to elevate community voice, First5 is training staff and parent leaders in order to launch PLTI later this fall. It's a national model. It's been around for 30 years. It's never come to Sacramento before, and this is our first opportunity to bring it here. We'll work with 25 parents over the next 12 months. And each parent will be a part of the leadership cohort and will select a civic activity or project to work on. It's pretty exciting to see what they will decide to do here. Our lead staffer on this, Alejandra Labrado, who, as you will recall, ran our Community Connections grants and is really taking that lead in community voice and parent engagement. She wrote several grants. We just found out last week we got funding from HealthNet, $40,000 to offset. We have $40,000 in our systems improvement funds, so we found a dollar-to-dollar match to be able to launch the program. We also have an ask out to SMUD and are waiting to hear back from that. So very exciting. Great stuff happening with our leveraging and with bringing in new dollars to launch new programming. Super exciting time. On to the state budget, which was recently approved. And in your packet, there's a pretty comprehensive 4-page highlights of the state budget and all things sort of related to children, young children and families. So just as a quick cheat sheet of what's happening. Overall, pretty good budget for kids and families. And then finally, to wrap it up, just a reminder that our next meeting will be a Commission Strategic Planning Retreat. We will be meeting at Sierra Health Foundation in their large conference room, and commissioners have all had their invitations, their meeting calendars updated to include the new location, and for you all, an 11:45 invite so that we can have lunch together as a commission, and then a start of 12:30 for the rest, for the start of the meeting. So just let me know if you have any questions about that, and that concludes my Executive Director's report.
Great, thank you, Julie.
Sure.
Any questions for our Executive Director? Yeah, Commissioner Wirtz.
Thank you. Just one question, two things. I'm really pleased to see the parent training piece because that is a way to bring parents into some leadership roles, and I think that fits with our racial equity goals. So that's really exciting. One question: Are they stipend or anything for these trainings?
Correct.
Excellent.
They are stipend for the trainings. We actually are contracting with an agency that did our stipends during the Community Connections grant. So we're partnering with Lead for Tomorrow. Actually, all the money that we're able to draw down from the different co-funders is all funneling straight to Lead for Tomorrow, which just is a lot simpler from a county perspective of dealing with community stipends.
Excellent. And then the other question, I think I've asked this before, but on the Afghan refugee services, there is no recognition or involvement with Latinx immigration issues.
Not at this point. The criteria put down from First5 California is very specific as to having a refugee designation, fitting the definition, being part of that definition, and then a specific date for arrival. So the First5 California Commission, I think, is very interested in opening that discussion, and I believe it will be a part of their decision-making when they come back to look at additional funding.
I appreciate that. Obviously, we have a large Latinx population in Sacramento that is in need of some of these same services for their immigrants as well. So I just want to keep that on hopefully on the future agenda.
Indeed. Thank you. Noted.
Okay, any other questions or comments for the Executive Director? Madam Clerk, we don't have anyone signed up to speak on this item?
No, sir, we do not.
All right, very good. Thank you, Julie.
Welcome.
We are on to our advisory committee update.
Great. Well, I am truly happy to introduce Sylvia Rodriguez. She is our new advisory committee chair. And we'll, I think you're going to go right there. There you go. Sylvia's been a member of the advisory committee for quite some time. She was our vice chair, and then with Robert Silva's resignation, she graciously joined us in the new role of chair. And she's going to give the presentation today for advisory committee. And because she's also the vice chair of the financial planning committee, she's going to jump back and give that report as well, since our chair is out today.
Great. Actually, if you bring the two mics on the lectern towards the center, that's the best way we can hear you. Thank you.
Can you hear me?
Yep.
Good. Well, good afternoon, Chair and Commissioners. I am very glad to be here today. A little bit about me. I am Sylvia Rodriguez. During the day, my day job is to work with the Department of Corrections and Rehabilitation. And my part-time at night is to sit on the local mental health board, where I also chair the Children's Systems of Care. And back in February, we submitted a report that deals with school mental health. In June of this year, I assumed the position of chair for the advisory board. And I'm also happy to report that we also named Jose Goris, also known as Junior, as your vice chair for the advisory board. And we also appointed Edward Lewis to the early care and educational seat. The important thing about Edward is that he also has a connection to housing. So we wanted also to highlight that side of Mr. Lewis. With regards to the advisory committee, I'd like to give you some highlights of what we did in the last 2 months. July 8th, 2022, the advisory committee had a joint meeting with the Systems Optimization and Sustainability Committee. And we talked about race, equity, and inclusion, and cultural responsiveness pursuant to your direction. And April facilitated the meeting, and that meeting was dedicated for that topic and that topic alone. The meeting centered around the purpose and the vision, the roles and responsibilities, communications and infrastructure, and ongoing learning and capacity building. Committee members sort of self-selected where they wanted to go, and at the end of the meeting, we came together, and all of those ideas were sort of merged into a document that will be shared with you in the month of October. Do you have any questions on that? Okay. I'm going to jump into the Financial Planning Committee report. Come back?
Do you want her to do that now, or should we wait till we get to that agenda item?
That's a separate agenda item.
Okay,
So does that conclude your advisory?
That concludes my advisory.
Okay, very good. So do we have any questions for our chair? Doesn't look like we do. All right, very good. But we do have an action item around this. We do need to appoint Mr. Lewis to the early care and education seat. So at this point, I'd entertain a motion.
I so move.
Okay, it's been moved by Commissioner Wirtz. Is there a second?
I'll second.
Was that Commissioner Qatari? Okay, very good. Madam Clerk, do we have anyone sign up to speak on this?
No, sir, we do not.
Okay, with a motion and a second, please vote.
Great, motion passes. Thank you.
Very good, thanks. Michelle, is your...
It's a yes.
Okay, is it not working?
No, I had to ask if I was allowed to vote.
And
Oh.
because
get it quick enough.
Siobhan is here and
Okay.
Michelle's an alternate, then
Got it.
she doesn't vote. Yep.
Got it. All right. Okay. All right, so now we are on to evaluation.
Thank you, Chair Cerna. We held our evaluation committee meeting on July 18th. and it was a hybrid format. We had some people in person and some through Zoom. The staff report dealt with data collection items. We looked over the Persimmity user survey. We also learned about the family information form that Carmen was using to gather post-family information form information for the first time, and we think that's a tool that will be useful ongoing. And then with regard to, we're already going to be talking about the Birth and Beyond report later, so that we did not touch on that at this meeting. We had been doing that for the last 2 meetings. But applied research, survey research presented to us both the cross-systems racial equity snapshot pieces that you'll see more about today, and the Sacramento County trend report data. And in both of those, the committee reviewed and commented on the report and the use for strategic planning. One comment that we raised was that if the county trend report is going to be used for the broader or for the strategic planning, there will be a need to add additional information on the broader social economic trends in the county to better understand the context and the forces impacting the success of these program and programmatic efforts. So we're looking forward to that process in October and so on. And our next meeting is September 19th. And with that, I believe that's it. If there's any other comments from committee members.
Okay, thank you, Commissioner Wirtz. I don't see any questions by commissioners. Madam Clerk, do we have anyone from the public that wishes to address this item?
No, sir, we do not.
All right, very good. We don't need to vote on this, but appreciate the update. All right, now we are on to the Finance Planning Committee update.
Really good job updating the committee on the status of the American Rescue Plan Act funding for 2 programs, Building Strong Communities and an augmentation to the Child Abuse Prevention Funding. Training will be provided to staff and contractors on the appropriate administration of this federal funds. Several contracts are being negotiated and developed to implement the programs beginning in September. A new grant was awarded, as Julie said, from First5 California to assist refugee families in the Sacramento area. And as Julie mentioned, is in the amount of $570,000 to be working with nonprofit agencies for this population. The committee also presented the revised recommended budget and reviewed the changes from the approved recommended budget. The budget included additional revenues for refugees, as we just mentioned, and CalWorks, along with the corresponding expenditures for those programs. The committee approved the revised budget along with a 10-year financial plan. The committee was also updated on the progress of the fiscal year for 2022 and resulting from the independent audit, which is currently in progress. The final report should be issued to the Commission in October and presented to the Commissions in November and December. Or the report should be issued to staff in October and presented to the Commission in November or December. Year-end reporting and financial statements were viewed by the committee, and there were no questions or concerns. That concludes this report. Do you have any questions?
Very good, thank you. Any questions?
Okay.
All right, don't see any, thank you.
You're welcome.
Madam Clerk, do we have any members of the public signed up to speak on this item?
No, sir, we do not.
All right, very good. No vote required on this. So next we will go to item 7, which is our Systems Optimization and Sustainability Committee update.
Good afternoon. The SOS Committee held a regularly scheduled meeting on June 21st, 2022. Committee members discussed the 2022-2023 legislative state budget, highlighting investment supporting children and families and provided staff with an update on the implementation of budget provisions adopted last year. Heidi Kaiser discussed the Sacramento County's Children's Coalition letter to the County Board of Supervisors, highlighting key recommendations in support of their passing a family-centered budget. Lindsay Dunkel provided committee members with an update on strategic planning, timeline, and activities. April Jean, the Commission's Ready consultant, reviewed outcomes from the joint SOS and advisory committees meeting in preparation of the second joint meeting on July 8th. Our next SOS committee meeting is scheduled for August 16th at 12 p.m.
Great, thank you. Any questions by commissioners? All right, seeing none. Madam Clerk, do we have any members of the public signed up to speak on this item?
No, sir, we do not.
All right, very good, thank you. All right, now we are on to item 8. And I believe this is a public hearing, approval of final budget for 22-23 and 10-year financial plan.
Thank you. Good afternoon, ladies and gentlemen of the commission. My name is Eric Harold, Chief of Administration, First5, Sacramento. So what we're looking at here today is our revised recommended budget. As you recall, back in May, the commission passed the recommended budget. And the revised recommended budget is designed to capture any changes that are derived out of the state budget and anything else that may have occurred. I want to go ahead and have you refer to attachment 1, budget changes. And essentially this year we have 4 budget changes since the approval of the recommended budget. At first, I want to take a look overall what that looks like, and that's at the top of this attachment. Our expenditures will increase from $20 million to $20.6 million, or roughly a $1.5 million increase. And our revenues will also increase from $19.2 million to $20.6 million, or roughly $1.4 million increase. And then also, there's an increase to the net cost of the fund balance of $89,000. Excuse me. So the 4 changes that occurred are basically the counties finalizing their labor agreements, and the assumptions that were used in the approved budget were not quite the same as what finally came out with the labor agreement. So there was some additional costs. There was an extra 1% for the COLAs. There were some other benefits that increased the overall cost. So this first group of accounts, Object 10s, salary and benefits, you're going to see the exact GL accounts that were affected for a total of $89,000. I'm going to skip over the next group of accounts and look at the revenues first, and we'll look at the 3 other changes that occurred in the budget. And they've been talked about a little bit here. So we've got the new refugee assistance grant, and that's $570,000. Unfortunately, our home visiting coordination grant has decreased this year by $86,000. We're expecting that to, there's a good chance that those funds will return the following year. So and then next account down, which is the CalWorks, is increasing by $950,000. And what was happening there was last year, the state cut the CalWorks grant by $950,000. And then towards the end of the year, they reinstated the allocation back to its original amount. And it was too late to get it into the recommended budget, so we're recognizing that allocation increase in this budget, the revised recommended budget. If you go ahead and move on to attachment 2, the budget highlights. This is a report pretty much most of you are familiar with. This is kind of a highlight of what's going on with the budget. It's the same as what was approved in May, just with the 4 changes that I've discussed earlier. So at the top, you have basically how the costs are allocated, and that's 5.1 for administration, 1.9 for evaluation, and 93% for program. And beneath that, you can see the exact percentage and dollar allocation for each of the programs. And then finally, I want to look at, well, not finally, to continue, I want to look at the revenues that are listed at the bottom here in the middle. As you can see, they total about $20.6 million. And then just above that revenue list, you're going to see $941,000, and it's highlighted in blue. And that's the additional financing we require for this budget year to have a balanced budget. So normally we get that additional financing through a reserve release. And so we'll go ahead and take a look at that reserve balance in that call-out box over to the right. And you can see we're starting fiscal year 22-23 with a reserve balance of $20 million. And then we're going to have a carry-forward fund balance of $1.5 million. And I'll just remind everyone, a carry-forward fund balance is pretty much the money that wasn't spent in the prior budget year is there. It exists as financing for the next budget year. So if you recall, I mentioned that we need $941,000 in additional financing, and we have $1.5 million in carry-forward fund balance. So we don't need all of that, so we get to do what's called a provision for reserve and put $500,000 back into the reserve. And then the remainder, the $941, will be used for the financing of the current budget year allocation. Okay, we'll see how these changes look going into the next attachment, the 10-year financial plan. There's not a lot of changes to this aside from reflecting those changes that we talked about. At the top, you'll see in the green highlighted column, you'll see that provision for reserve is at negative 517 that's getting put into the reserve. And then the other thing I'd like to point out on this is on the 2027 strategic plan period, it's the last three columns on this report. You're going to see that in the middle there, the strategic plan reduction is 26.8%. That varies from what was presented in May, which the reduction was going to be 28%. So it's decreased over just 1% based on us being able to put more funds into the reserves. So we're hoping that number, that 26.8%, is going to be reduced over the years as we realize more carryover fund balances in the budget years leading up to fiscal year 2027, or to strategic plan 2027. Also, I want to use this forum to kind of launch into a discussion a little bit about our presentation, a little bit about our leverage funding, our sustainability efforts. I made a presentation in the Financial Planning Committee, and they thought it would be a good idea to bring this presentation to the Commission. So if you look at the form or the revenues on this, over to the left, you're going to see Proposition 10, MA claiming, which is Medi-Cal, and you're going to also see some federal and state child abuse prevention grants, CalWorks, home visiting, and on. And those represent the efforts that the Commission has made to sustain or leverage additional funding for services in the community. And to illustrate it, we'll go ahead and take a look at attachment 4, which is the sustainability efforts. If you recall, the Commission made a commitment to, putting together a sustainability plan and committing to sustainability efforts. There was an investment to hire technical assistance experts for sustainability. We brought in all of their contractors. We made online training available to all of them for free. And ultimately, this was our certified sustainable program that ended with a written sustainability report for each of our contractors. And you can see prior to these efforts, we averaged around 11.1% in sustainable or in leveraged funding. And then since then, we've averaged around 33% in leverage funding, culminating in this 22-23 budget year of an estimated $7.6 million in leverage funding. So I think it's kudos to the commission for your commitment towards sustainability efforts and actually investing in those efforts. And I think Julie might want to have something to add.
I would love to just say a few words because I'm incredibly proud to work for a commission that really intentionally puts sustainability sort of at the top of our to-do list. And you all have given us the flexibility with our staffing in order to really react quickly and be flexible when there are these funding opportunities. I've had the great gift of also being a county employee at this commission, so I've got to meet my fellow department heads like Commissioner Callejas and Ethan Dye and others that have just really allowed me to build those relationships and partnerships so that First5, even though our funding is declining, we continue over the years to bring in more and more new partners. And that means more and more funding for kids' services. So while our budget has declined, every year that I think I've been here, it has been increasing and increasing with outside dollars. So I just wanted to say thank you. It is because of your willingness to let us have staff whose jobs are really to bring in dollars and to work on sustainability that this is happening. So I appreciate that. The staff appreciate that. And it's one of the reasons we're able to bring you 3 new programs just this year. So I'm very proud of that work.
Great, thank you.
Yeah, so I'll just finish by saying that, so over those 4 years, we've leveraged almost an additional $24 million in outside funding. And with that, I'll conclude my report. Are there any questions?
All right, any questions for Eric? I had one question, Eric. Can you remind me again, how do we account specifically for Prop 10 dollars? I assume when we look in the out years through the various strategic plans on attachment 3, and those are estimates of how much we believe Prop 10 is going to decline, tobacco sales are going to decline. So how do we true up with like an actual on Prop 10 revenue?
It'll show up in the fund balance. At the end of each year, you're either going to be high or you're going to be low, and that'll go into the fund balance, and it affects the strategic planning, future strategic planning periods. It will either make more funds available to those periods or less funds available. And that's one of the reasons we looked very closely at the Proposition 10 funding. I think the Financial Planning Committee will remember we presented the state's projections, some statistical projections, and what I felt like was going to happen. We kind of looked at all 3 models and kind of took an average of those. And we're also going to have a big impact based on the election or the ballot in November based on banning flavored tobaccos, the sale of flavored tobacco. So that could have a big hit. The state thinks it'll be over a 20% hit in revenue. So we also took a measure to kind of half that amount because it may pass, it may not pass, as kind of a safeguard to mitigate against big changes. Because going down the middle of the road, it's either going to be a little bit worse than we thought or a little bit better than we thought. So. But those will get trued up in the strategic planning process and through the fund balance because we basically lock into a 3-year commitment. And if we do worse, it's going to look, we've got a few years to plan for a little bit worse, or a little bit better.
Right. Great. Thank you.
You're welcome.
Okay. Yeah, Commissioner Wirtz.
Thank you. 2 things, Eric. I really appreciated your presentation walking through that like that. That was very informative and clear, so I appreciate that. And I hope now my question doesn't just distort that. But so on, let me see, the item, oh, there it is, attachment 3, the fiscal year 23-24 has as total expenditures around the 14.8 or 0.9 million. Is that likely where we're at, or is this? So I'm just getting confused about that number.
That 14.8 million is the approved strategic plan amount.
Yes.
Okay, but then to the side of that, or, in addition to that, other actions are taken by the commission, such as approving CalWorks or approving the refugee assistance. So those become adjustments to the approved strategic plan, and those are listed at the bottom. So you'll see, because obviously we're asking for a $21.5 million budget, and our approved strategic plan is 14.8 or 9.
Yeah.
So there's adjustments through commission actions that make up that difference, and those are what are listed at the bottom.
Excellent. And so that will get filled in for 23-24 at that time. Yeah.
Yes.
All right. Thank you. That's
You're
very
welcome.
clear.
Any other questions for Eric? All right, very good. Thank you again.
Sure.
Madam Clerk, do we have any members of the public signed up to address the budget?
No, sir, we do not.
All right, very good. We do need to, I do need to open the public hearing. I should have done that before. Knowing that there are no public speakers, I will close the public hearing and call for a motion.
I'll make a motion. Do you want two separate motions, Chair?
No, I don't think we need to.
No? Okay.
Yeah.
I'll make a motion to approve staff recommendations for the fiscal year 2022-23 revised recommended budget and the 10-year financial plan.
I'll second.
Very good. Okay, it's been moved and seconded. Please vote.
Thank you. Motion passes.
Thank you. All right. As I mentioned before, we are going to switch the orders in the next two items. So at this point, we will entertain a presentation of the fiscal year 2021 Birth and Beyond Evaluation Report.
Fantastic. And we will be joined by Jordan Ketty from ASR to do this presentation for you.
Good afternoon, Commissioners. Thank you so much, Julie. I'm excited to be here today to present the Birth and Beyond Annual Report for fiscal year 2021. Commissioners may recall that they received information about the Birth and Beyond program in the First5 annual report that was presented in March. This is going to be about the full population that Birth and Beyond served, ages 0 to 17, as opposed to what was in the First5 report, which is just focused on 0 to 5. Birth and Beyond funding is majorly provided by First5 and DCFAS, who allow them to serve the full range of children ages 0 to 17. Just some information about overall reach of Birth and Beyond in the fiscal year of 2021. They directly served 6,575 parents and caregivers and 2,640 children. And the average number of hours served across all of their programming was 5.4 hours per individual. Birth and Beyond provides 4 major categories of services for families: home visiting, parenting education, crisis intervention, and enhanced core. And those are listed on the slide in order from most intensive to lightest touch, being enhanced core. I want to take this time now to talk about some of the most exciting findings that we have had for Birth and Beyond, and that will be the quasi-experimental design that was conducted last fall. This was conducted with AmeriCorps funding, part of Birth and Beyond's AmeriCorps grant, but we were able to also analyze all children that Birth and Beyond served, not just those who were served by AmeriCorps. The goal of the QED was to be able to compare outcomes with CPS involvement for children who participated in Birth and Beyond home visiting and be able to compare them to a like comparison group. So instead of just comparing to the general county, which may have lower risk factors than the population that Birth and Beyond serves, we created a matched sample with partnership from Child Protective Services, who provided us a sample of families who were not involved with Birth and Beyond home visiting, but who did have CPS involvement during the time frame that we were looking at. We then matched our Birth and Beyond sample with that comparison sample from Child Protective Services on a vulnerability index, which includes those bulleted factors. So with the goal of being able to say that this group that we served, that Birth and Beyond served with home visiting, was as similar as this county comparison group as we possibly could make it. Obviously, there are some factors that we couldn't match on, but that the major difference between the two groups was Birth and Beyond home visiting. So we were trying to isolate the impact of Birth and Beyond home visiting. So the first exciting result that I will show you from the QED is for children ages 0 to 17, so all age groups. You can see that the treatment group, that is the group that received Birth and Beyond home visiting, was half as likely to have another substantiated allegation with CPS after Birth and Beyond home visiting. So compared to that group that we made as similar as possible to our Birth and Beyond group, our Birth and Beyond group really showed much more positive results and less involvement with Child Protective Services after intake to Birth and Beyond. So this is very, very exciting to be able to show the direct impact of Birth and Beyond home visiting for this age group. We also did split out by age group. This is just for those who received 8 hours or more of Birth and Beyond home visitation. You'll recall from the March presentation, we showed the age 0 to 5 results, but that was for all dosage levels. And so I do have that slide as well, who includes those who received less than 8 hours, which is considered the minimum home visiting intervention level. And we can review that at the end if interested. But they have very, very similar and very promising results, displaying that Birth and Beyond home visiting does create and have an impact on those children to have them be less likely to return to the CPS system. The other point that I want to make clear on this slide, comparing ages 0 to 5 and ages 6 to 17, is that it looks as if Birth and Beyond home visiting has the most impact for the younger child group. That is most likely true, but I also do want to make clear that children ages 0 to 5 are more likely to experience child abuse, so we have a larger sample in that group as well, and just overall countywide, they're more likely to experience child abuse. Are there any questions about the QED before I move on? Very exciting results, and
we actually do.
Oh.
Sorry. We'll start with Commissioner Kayes.
Yes.
Can you just remind me, so the home visitation is nurturing parenting program?
In this case, yes. So Birth and Beyond in future years is moving away from Nurturing Parenting Program, but for the presented results, it is Nurturing Parenting Program.
Thank you.
Commissioner Wirtz?
Yeah, just to say that, one, I think these are powerful results, and I'm hoping to look at that other slide afterwards that focuses on the 0 to 5 people, but I just want to highlight that these results are for this 8 or more hours of service.
Correct.
And so one of my major concerns all along as a system, not as a Birth and Beyond in itself, but as a system, we have a referral system from CPS that goes then to Birth and Beyond and services and so on. So to me, I'm concerned about how the system works. Mm-hmm. And that means taking into account people who don't get 8 hours
Right.
of service, because there's, as you can imagine, it's hard to get people into these programs. It's hard to motivate and engage them. And that's our challenge. And if we ignore how we're doing with them, we're just ignoring a major way of looking at how to improve our system. So that's why I'm going to come back to talk about the other slide as we get to it.
Yes, and thank you for mentioning that, Commissioner Wirtz. I'd also like to add that Birth and Beyond did do a supplemental analysis. They've done it 2 years now, looking at specifically those children who received less than 8 hours of home visiting and who had a subsequent CPS referral to try to really zero in on the factors that seem to present themselves with that more at-risk population. And so they are doing work to focus on the less than 8 hours as well, but I completely agree with you that I do think it's very important to focus on all those who were served, and then also to look at those who received what they consider the minimum intervention dosage, which is that 8 hours. Thank you. Continue?
Please.
Great. I'm also just going to talk about the other programs that Birth and Beyond has as well, so that you know the full breadth of their program. There were 1,114 families served within the home visiting program. Of those, 424 received a developmental screener, an ages and stages questionnaire. Of those, 20% had a developmental need. And the referrals to Help Me Grow developmental services were 357. And of those referrals, 52%, so over half, did end up receiving services related to child development. They also have separate funding source for their CalWorks home visiting program, so we wanted to make sure that we highlighted those results as well. There were over 2,000 home visits completed through the CalWorks home visiting program, 180 developmental screenings, and one of their large focus areas here is on the referrals that they are making through the program. So we just highlighted some of the most common referrals, and you can see quite large amounts, over half for most of them, did receive the service that they were referred to. Parenting education is the next category, and in this report, there are 2 parenting education programs that Birth and Beyond used that will be changing in future years, so keep an eye out for that. But they served 537 parents in the Make Parenting a Pleasure program, and then the Nurturing Parenting program, you can see has different types of programs depending on their child's age. And so you can see where they were serving the most people. And I would like to mention also that some parents took multiple parenting education courses, which is wonderful. And so that's why all of these numbers will add up to more than the total 805 parents served. That's the unduplicated number. We measure parenting education using both the AAPI and the Make Parenting a Pleasure tool. And you can see that across the 3 biggest parenting education programs, Making Parenting a Pleasure, Nurturing Parenting Program, Infants and Toddlers, and then Nurturing Parenting Program, School Age, that there were statistically significant increases in parenting knowledge for all 3 of those programs from pre to post after participating in the parenting education. The next service that I'm going to talk about for Birth and Beyond is their crisis intervention services. These are lighter touch than home visiting, but provide services and referrals to families who are in crisis. So they served over 2,500 families and provided 82% of them with at least one referral. We saw across the board significant reductions in reported stress and increases in community and social support, as well as knowledge about resources. And all 3 of those were statistically significant as well. Their enhanced core programs provides the lightest touch services to families. This examples are things such as stress-reducing events, large events for the community, etc. 1 in 5 families who participated in these light touch efforts also participated in crisis intervention. So that shows that we are trying to rope in families with our fun light touch efforts, but then also educate them about other services that Birth and Beyond provides as well at the same time. So we can see that that is being successful. I wanted to finish this presentation with a quite powerful quote. This is from a participant at the Meadowview Family Resource Center, and she writes, "You guys helped when I didn't have a job. You helped with food and helped with Christmas. I am happy because I got car seats and a playpen for my baby. You guys always call me and check on me. I'm really grateful to your center for supporting me." So I just wanted to really highlight that because I think it emphasizes the multitude of services that Birth and Beyond can provide a family. With that, I will ask for any questions, and we can refer to that extra slide about the quasi-experimental design at Commissioner Wirtz's suggestion.
Thank you, Jordan.
Thank you.
Commissioner Qatari, then Commissioner Wirtz.
Yeah, thank you, Jordan. This is great. Very exciting program. I have a question about the CalWorks home visiting slide where you presented referrals.
Sure.
And just looking at the number of folks who ended up going on to access those referrals, and just wondered if there was anything that you could share that maybe you learned along the way about what some of those barriers were that created access issues, because on the face they look a little bit low, and I just wondered if there's something we need to be thinking of as service providers to do differently. Thanks.
Thank you. Referrals are always sort of a difficult point. So it's difficult to provide the referral and then assist the client with follow-up on the referral and then have them actually access the service. One of the main barriers is services having long wait lists or being unavailable. And that is something that unfortunately Birth and Beyond has no control over. So we are improving our closed loop referral system so that we can get the most accurate information as possible for if clients did end up accessing the service. And that is going through the Persimmon referral portal through First5. But the other piece of this too is the major point of evaluation is to really spot areas that need improvement or that could be further delved into, and I think this is definitely a piece of that. So the CalWorks home visiting program is relatively new. It was implemented in spring of 2019, so they are definitely still working out all of the kinks and best practices. But the other piece too that I do feel should be mentioned is how strongly COVID has impacted many possible referred services, and that services are quite often being either reduced or canceled or changing. And so that's another piece that largely plays into this as well.
Thank you.
Thank you for your question.
Commissioner Wirtz.
Thank you. Jordan, first I want to thank you and ASR for the work you've done over the last years here on helping us at First5 work on improving the evaluation efforts that we're undertaking. So I kudos to you and your team, and I appreciate your reciprocity and working with us on the evaluation committee and with me in particular and so on. So I appreciate that very much. And I too was concerned about this particular slide, looking at the 29% access of adult employment. A couple things to say. The evaluation committee has been focused a lot over the last couple years around referrals, and it's not unique to the CalWorks program that we are concerned about increasing closing the loop on successful referrals. So it is a challenge, and I know Julie and her staff have been working on this, and I think it remains a fairly high priority to do, and I think it's really critical to our success that we continue to work on that. So, but I just point out the adult employment happens to be the lowest one there, and again, as you generally know, many of our families, bottom line, the thing that could help them most is getting them good employment and stable housing, and the housing is the second lowest one. So I want to just point out that First5 has a real challenge and a real opportunity to try to improve its approach to working on these social determinant components of housing and employment. So I'll just highlight that particular piece. And then if I could, if you would go ahead and show the other slide.
Yes.
What I wanted to point out, again, this slide comes from what I think page 71 of the Birth and Beyond, of our annual report, fiscal year 2021 from March. So we've seen this before, but I think we haven't taken full recognition of what it means. In essence, our program for Birth and Beyond, with partnerships with the Child Protective Services and so on, has been able to cut in half the recurrence rate for child abuse and neglect in our families. And I think that's what I wanted to say is that Birth and Beyond and our home visiting programs have been one of our longest term and major investments over the years. It's also been consistently one that has struggled, or I'm saying struggled but succeeded in including evaluation throughout its history. And consistently throughout that time, it has shown positive results. However, I'm a scientist, and I understand the difficulty of documenting actual program impacts. And so I wanted to highlight this because I think it is the strongest evidence that First5 Sacramento has been able to generate through evaluation research. And the major reason for that, unlike the focus of the Birth and Beyond program itself, which is saying we can't be held accountable for if we can't give them the full level of service, the 8 hours. But I understand that. But I, as a commissioner, am concerned that us as a First5 are accountable for the outcomes that we get. And that's contingent upon our partnerships with our provider networks and with our county agencies. So the unique thing about the way this evaluation was done was that it took a sample of 0 to 5, which is our age group, and then did the kind of development of a comparison group like Jordan laid out. But it took all of those people. So if CPS referred a case to Birth and Beyond, there's the referral, right? There's the gap in referral. And if you don't deal with that, then we're stuck with losing families and not being able to help their children. So this took what is a part of what is in randomized controlled trials. You try to get a equal set of samples to compare. And one way they do that is what's called intent to treat. So if you get assigned to Birth and Beyond, the outcome is on your shoulders, or the Birth and Beyond outcome is on the shoulders of who assigned that to Birth and Beyond. This analysis demonstrated when you did that with intent to treat, all three,
342.
342 of these kids, whether they got the service or not, are compared with another set that didn't get that service. And even with that conservative, strong test of the results, you get this reduction of half of the recurrence of child maltreatment, which is remarkable. And I just have to just sort of establish that as a valuable piece of information that this commission needs to have and to celebrate, and then to continue to work on how to improve our efforts to prevent these kids and these families from having these struggles to get to this point. And that's where jobs and housing and other social determinants of income and support and education become critical, that we partner with our other agencies to do that. So I appreciate having the moment to highlight this success and point it out again with some priority. So thank you for the time.
Great. Thank you, Commissioner Wertz. Jordan, if you can go back to the previous slide that you had up, please.
The CalWorks?
I think so. That one.
Yep.
Yeah. So relative to the housing support, where you only had 4 out of 10 accessing services for housing, what's the detail behind that? Is there something that we should know, for instance, about the involvement or support coming from another agency like Sacramento Housing Redevelopment Agency, our partnership with various nonprofit organizations that provide transitional housing or permanent supportive housing. What do you attribute this low number to?
Housing was actually the specific referral that I had in mind when I was mentioning about the wait lists. This is something that has come up multiple times, not necessarily in this evaluation, but we did a previous evaluation where we interviewed home visitors, and they specifically named housing as one of their biggest frustration points, because they said, I can connect them to Section 8, I can connect them to these different resources, but I cannot do anything about the multi-year wait list that they would experience. And so from that knowledge, that is the most that I have about that. But unfortunately, housing is not my area of expertise, so I'm interested to hear if any other commissioners have potential solutions for that.
Well, I think if I did, I might be in a different office somewhere. But, no, but I asked the questions in all seriousness because I think it's important, especially for those of us that cross-pollinate with county service delivery and governance, to know if it's a case of vouchers not being available. Kind of the specifics about what are the highest hurdles to attaining housing. So I'm glad you mentioned it. If there is any detail behind that you can share that's in writing that gives me even anecdotally, or all of us anecdotally, a better understanding of what those barriers continue to be, that would be helpful.
Yes, I will reach out to Birth and Beyond and specifically their home visitors and see if they can give more detail about the specifics of the housing and any of the other referrals that are listed here as well.
Okay, great, thanks.
Thank you.
Commissioner Gayas?
Thank you, Jordan, and also on this slide. So the CalWorks Home Visitation Program is for Healthy Families America?
Correct.
Only, right?
Correct.
So
Right now, yes, but they are launching PAT as well,
Okay.
parents as teachers as well, so they'll have two unique evidence-based models running.
that will cover different age groups?
Correct.
Correct.
Because
Yes.
the Healthy Families America is very
restrictive.
limited, right?
Very.
And so I just wonder if that has any impact on the low referrals because it is so narrow. I have no idea though what that is.
That's an interesting point because I know for enrollment to HFA, you have to either be pregnant or have an infant up to 3 months old. So
Exactly.
it is very restrictive, and that is the reason that they're moving to the parents as teacher model in addition. But again, I can reach out and let the entire commission know what I hear back about potential reasons for the specific low referral access rates.
And then one other question related to the adult ed and employment issue, given that narrow criteria, could child care issues be one of the barriers with respect to pursuing employment?
I imagine that is likely a large barrier. Yes.
Thank you.
Yeah, we have had an influx of state funding around childcare, and we can ask Commissioner Sneeringer later to fill us in on how that's impacting this potentially. And I do know from early on with the CalWorks program that the homeless rate, or it's like unsheltered rate for those clients was higher than I think almost any of our other programs. And so that is one area that we can definitely dive a little deeper into to find out why that access rate is low.
All right, Commissioner Wirtz?
Just a clarification, I appreciate this discussion and appreciate the finding out any more that we can on this. But I would just highlight that in our other programs, we find the same level, not specific, but the same level of referral limitations as we're seeing here, not comparing it one-to-one, but in general. So I think this issue, Michelle, you point out clear reasons for potentially impacting these. But the programs we have, our referral system that we've looked at, I know David's been concerned about a referral to, prenatal care and so on. So this is an ongoing issue on multiple levels. And so the challenges are widespread, not just with CalWorks.
Very true.
Yep.
Commissioner Fernandez de Garcia.
Yeah, I agree that referral uptake is a huge, challenge for everybody. And it comes from the person who gives the referral. And there's plenty of interventions for how to teach people to refer, right? Because it's some behavior change that can be used to increase their openness to the referral. And I've anecdotally heard a lot of, for example, hesitance to home visitors in general because of, allowing people into your home. There's some issues with that. But my question was actually around the developmental screenings as a pediatrician and whether or not you have any information about those outcomes and referrals around the developmental screenings.
We are working on getting the outcomes for the ASQ developmental screenings, and that is one of our goals for the next report. And we do have information about the developmental referrals. They are in the larger report for Birth and Beyond, but it wasn't one of the most common ones, which is why we didn't list them here. And I also wanted to just say also to both Steve and Eric's point that this is a great conversation that I'm glad that we're having. And I do think part of it is the training of the navigators. We do also in the full report include sort of a middle step between the referral and accessing, which is followed up. So were they assisted or did they follow up on their own? And then the access services as the next step. So that sort of provides insight to where our navigators are helping them to follow up. And then they can't necessarily make them eligible for services or, take away the wait lists. So that can kind of further inform where we need to educate our navigators as well by looking at that % followed up as well.
All right, great, thank you. I don't see any other, Commissioner Wirtz.
I'm sorry, Commissioner. Just to follow up on that, the other side of that is the next step, is who they get referred to and how those people handle that referral.
Right.
And there, I think, to Eric's point of sensitivity to the client and the diversity of the staffing and their approach is also important. And as our collaboration is so strong with so many agencies, it seems like that is an area for us to at least explore. How well are they doing on racial equity and in their engagement with our clients? I think that's on us as well to look into that aspect of it too. It's not just a halfway referral, it's the full referral to the other team members in our collaboration. So
Yes.
just keep that on the agenda as well.
Yes, and I do want to say too, Birth and Beyond has a culturally responsive initiative that they are working through, looking at things like the equity of their referrals. So I do think that's important, and we can add that and make sure that that's something that is communicated that is in importance to the commission as well, to make sure that they add those as well.
Okay, Commissioner Fernandez de Garcia.
Yeah, I'll just follow up to say that warm handoffs in mental health referrals have been, particularly effective in making that connection. I don't know if the folks making these types of referrals are, guiding our clients to the referral source via a warm handoff, but it's something that would be pretty effective, I think.
The goal is always warm handoffs, but that is limited by potential relationships that they have. So I agree that increasing systems connectivity with one another would really be really helpful for this. If a home visitor had a specific contact that they know at a mental health agency, just as an example, I think they're more likely to have a successful warm handoff.
Okay, great, thank you. Madam Clerk, do you have anyone sign up to speak on this matter?
I actually do have a comment that was emailed in, a public comment. This is from Sheila Boxley, the CEO at the CAP Center. She says, thank you to the Commission for the longstanding support of the Birth and Beyond program. The 9 family resource centers continue to be essential to our communities and are grateful for the opportunity to share the most recent information about the good work and outcomes.
Great. Thanks to Sheila. Thank you. All right. Thanks again, Jordan. All right. So now we will take up item 9, which is the 2024 strategic planning launch.
Great. Well, it is my great pleasure to introduce 2 members of our SEED collaborative team who've joined us today. We have Evan Holland and Dr. Nina Moreno. And they're going to walk you through the strategic planning overview, our timeline, and some key decision points that are going to be made along the way today. Not decision points to be made at the October, November, and December meetings. And then when they're done with their piece, we're going to ask Jordan to come back up again and to review some of the 2 data reports that are in your packet. So right now, we'll turn it over to Evan and Dr. Moreno.
Great.
Thank you, Julie. Good afternoon, commissioners. My name is Evan Holland. I'm a co-founder and senior consultant with SEED Collaborative. And the intention of our presentation and discussion today is just to do a quick orientation to the strategic planning process that we've designed in collaboration with the First5 Sacramento staff, and really, and most importantly, to hear from all of you about your expectations for both the process as well as the strategic plan document and its content itself. So that'll be our goal for our presentation. I'll turn it over to Nina in a second, but just want to orient us on what we're going to cover. So want to just do a bit of an introduction, do an overview of the process, we'll also do a bit of overview around the timeline, and then again, the discussion piece. So by way of introduction to SEED Collaborative, want y'all to know that SEED is a consultant company that focuses at the intersection of organizational development and diversity, equity, inclusion, and belonging. And so that's the frame we bring and the sort of perspective we bring in terms of how we support, assist, and facilitate strategic planning. And we'll do the same here with First5 Sacramento and working in collaboration with commissioners. We really come at this work from a perspective, from a framework called targeted universalism. That's a perspective that essentially sets universal goals, so goals for all involved, pursued through targeted strategies or approaches that really meet folks where they are. And as a part of that work, we really focus on co-creation and building alignment of intention. So our goal through this process is to ensure that we're not only meeting expectations, but that we're helping to build agreement amongst the commission for how you want to serve children in Sacramento County, particularly children 0 to 5, over the next several years of your strategic planning process, especially given the budget discussion that just happened today and the data we all just heard about. So that's our focus. Want to just briefly talk about not only the process, your expectations, but also your role in that work. So we'll get into all of that today. And I think from here, I'll turn it over to you, Nina. There you go. You want to introduce yourself?
Yes, thank you. Good afternoon, Commission. Dr. Nina Moreno. It is a pleasure to meet all of you, and I also want to say that it was a pleasure speaking with most of you recently as a part of this process. So good to be here today. And I'm going to move right in to a couple of slides that are really going to outline our timeline and what we're hoping to accomplish over the course of, a handful of commission meetings. So if you could turn your attention to the timeline, I want to just highlight 3 items on this slide. The first item is that this process is really made up of 4 phases. The first phase is an analysis phase that started a couple of months ago and encompassed interviews and focus groups, and we are about to launch a parent survey, actually this week, which we're super excited about, and the review of internal organizational documents and also external evaluations. That will culminate in an analysis that we will, both Evan and I and the rest of the C team will conduct, and we will be presenting on that in the next phase of this process, which is focused on really us facilitating and guiding you through the decision-making process. So we'll present those findings in October. And then the last phase of this process is literally drafting, refining the plan, and you all voting on it. The second thing I wanted to highlight is that there are three kind of critical decision-making points in this process. The first one will be in November, and that one will be directly related to making a decision about long-term strategic and funding priorities. The second one will be in December, and that will be related to medium-term goals and investment strategies. And then, of course, the last one will be in March when you actually approve the strategic plan. So those are just some of the things that I wanted to highlight. You know, we started in June. We'll go through March of next year. And I think that's everything. Do you want to add anything on this timeline, Evan?
I mean, I think what's important to note, and we'll talk about this in detail in just a moment, is that the October meeting, the November meeting, and the December meeting are really the opportunities to shape the long-term and medium-term strategies and priorities, right? Those are the meetings where the key conversations will happen that will shape those pieces of the plan. And after that, so today's orientation, we'll have those three meetings that are really the bulk of our planning discussions and strategizing together. And then the balance of the meetings are essentially reviewing the plan, offering feedback, and finalizing and passing the plan or approving the plan. So just want to sort of orient around those next three meetings are going to be key.
So here we are today, August 1st. Today's orientation introducing you all to us, but also the overview of this process, touching on the timeline and just the major benchmarks. We will be talking later just about your expectations of this process. We did that individually, but we really want to do that as a group so that we're kind of informing each other and having a group process around that and beginning to build consensus on that. And then we'll have a Q&A. We'll actually have a Q&A throughout this presentation. We're big on that at SEED. October 3rd is going to be squarely focused on presenting our preliminary data from all the interviews, focus groups, surveys, internal and external document review. For your consideration, and then we'll move into a data-informed discussion regarding the long-term strategic and funding priorities and possible investment strategies for First5 Sacramento 2024 through 2027. And then we will talk about vision, mission, and foundational principles. And then, of course, we'll have a Q&A throughout that session. In November, we will agree on long-term strategic and funding priorities, as well as vision, mission, and foundational principle statements. And then we'll start to move into a discussion on medium-term goals, funding allocations, and investment strategies. The meat of that, though, will happen in December, but we'll start that process in November. Of course, Q&A throughout. And then December 5th, will be a continued discussion on medium-term goals, funding allocations, and investment strategies. And then we'll decide. We'll decide on those goals, funding allocations, and investment strategies. Of course, Q&A. And then the last two meetings, February 7th, March 3rd. So February 7th, yes, that's right. February 7th, we'll present a preliminary draft of the strategic plan for you all to review and consider. You'll give us feedback. We'll engage with you around the kind of preliminary draft. And I know that meeting will be a virtual meeting, so we will be joining virtually. And then in March, we'll present the revised plan, and then it will be an opportunity for you all to approve that, and then we'll wrap up this process. Evan, do you want to?
No, I think you did great. Happy to field any questions.
All right, very good. Thank you. Yes, Commissioner Fernandez de Garcia.
Yeah, I had some questions about the parent survey. Will there also be parent interviews and focus groups, or are you just doing surveys?
So, yes, we did do a focus group with parents, and we already conducted that before, and that has informed, along with our other focus groups and interviews, the development of the parent survey.
Awesome.
Yeah.
And I've said this, I think I said this in our conversation, and I know I have in the SOS committee in regard to our READY work, but I sometimes feel that certain folks are asked to represent their community frequently, right? So I just wanted to suggest, if you haven't, trying to find parents who are the ones that never get asked what their opinion is.
Thank you for that. Just so you know, this survey is focused. The priority is on parents who are not familiar with First5.
All right, good.
I mean, of course, if it gets to families, parents, caretakers, et cetera, that are familiar, that will be an opportunity for them to lean in as well. But we specifically ask those questions about parents' familiarity with First5, and that is the focus in the outreach, the survey, community survey outreach plan, is to get to parents who are not familiar with First5 or connected.
And is there a focus on our Dari and Pashto speaking communities, as well as any other monolingual, non-English speaking communities?
Yes.
Okay.
So it will absolutely be available in Spanish, and we are looking at Dari right now, and it looks like we're going to be able to make it happen.
Commissioner Wirtz.
Chair, just wanted to add that we'll also be able to disaggregate data by those communities, right? So we'll be able to see trends and data around experiences of parents from different communities and speaking different languages against sort of the aggregated population, so we can understand the different experiences and so we can inform y'all to devise strategies accordingly.
Commissioner Wirtz.
Thank you. Just following up on that, one issue, one of our at-risk groups would be children of parents who don't have homes. And of course, they're not going to get any other access to surveys. And I'm particularly concerned about those children, obviously, like we all are. So that's a difficult thing, but I think Eric's right in pointing out that if we just ask the standard active, engaged parents, that's important, but it's not deep enough, I think, to get a real sense about what is holding these families back and how the county and our partners can address them. So speaking to that, in terms of the data collection part, I'm wondering, and this is not going to be a critique of First5 or the county services, but I wonder if we were to look at the status of our children in Sacramento County overall and those at risk back in 2000, let's say, 20 years ago, and we were then to compare that with now, I would venture to say that the numbers are going to be similar in terms of the number of at-risk children. I may be wrong about that, but I think if it's not substantially better on these social economic indicators of how many kids are in poverty, how many kids are food insecure, how many kids are housing insecure, if that's not different, then that's all the more reason why First5 should reconsider how it provides services. So I just hope that we look at these social determinants and the population level status of our at-risk kids and our overall kids. Because if we're doing, the old saying, if we're doing the same thing and getting the same result, then we're doing something wrong. So I just put that out there. It's a hard thing to do, and First5 has limits in what it can do. I understand that, but it is incredibly good at partnering, and it's incredibly good at getting a message out to other agencies and partners that need to be involved in saving and promoting the well-being of our children. So I just hope that can be in the mix of discussion, if nothing else.
Absolutely. Happy to support you with that discussion, bring that and probe with tough questions so that you're making, not the easy choices, but the right choices for the children of Sacramento. Appreciate the comment and question.
Okay, any other questions or comments from commissioners? I don't see any. Madam Clerk, do we have anyone signed up to address this?
No, sir, we do not.
All right.
Right. So then we'll just cover two other things before we wrap up.
All right.
One, this is not your first strategic planning process. It's First5 Sacramento, so some of this will feel familiar. But just as a friendly reminder in terms of your role, we're really going to be looking to commissioners to really grapple with data and the core issues as discussed here to help inform the long-term and short-term strategy for First5 Sacramento, ensuring that the strategy is not only mission and values aligned, but data informed, and we'll be bringing that information to bear as well as other data sources as we heard today. And really going to be looking for commissioners to think long-term and about what the sort of long-term priorities in terms of funding and strategy need to look like and what we then need to do in the medium term in order to head in that long-term trajectory. So we were asked to offer a friendly reminder about your role in the process. So you're going to be making decisions and grappling with data in order to make those decisions. So as a friendly reminder. And then the last thing, we just want to pose a question and ask, what are your expectations for this process and for the outcome? So we want to ensure that we're aligning with your expectations and that you are hearing from each other about expectations. We know we discussed that in your individual interviews, but want to hear today just a little bit about what are your expectations, again, for the process and for the plan itself.
Okay. Anyone want to jump in? I think that was probably one of the leading questions, if I recall correctly, when we had our individual interviews. I see Commissioner Fernandez de Garcia in the queue.
Yeah, I'm just excited to have the opportunity to have a strategic planning process that integrates the ready work, right? Because I think it's time for everybody to just have that be integral to everything that we're doing. So that's what I'm looking forward to about this process.
Commissioner Wirtz?
I'll make just one comment. I appreciate that as well. And I guess to me, I am hoping to see that whatever we fund, whether we fund new things or things that we've been funding, that what goes along with that is the ready work, is that part of our contracts or part of our funding and training goes into ensuring that the programs that we fund are working as a high priority to diversify its workforce, to recruit, retain workers from our communities, to build a pipeline for these kinds of workforce changes that we need, and that the programs and policies in these programs that we fund are committed to and explicitly state from leadership down that there's concern with and action being taken around racial equity.
Commissioner Calles?
I should say this is my first meeting, have not been part of a strategic plan.
Don't worry.
But we have so many opportunities ahead of us as a community in the whole world of prevention, early intervention. And so certainly us as social services agencies under Siobhan can look at how we better align and work together to streamline referrals. To Steve's earlier point, just the systems involved and how that can kind of clutter things. But also looking at how we can be mindful of this strategic plan, how it doesn't duplicate efforts elsewhere. And then to me, elsewhere, and I know Dr. Gordon, Steve, there are many of you that are also parts of these other processes, how we look at leveraging each other's resources to really get the biggest bang for our buck, especially with respect to our littles and children and families that that impact our system. We want them out. We don't want to see them. And so just kind of looking at it from a larger perspective, and that may be completely out of the scope of the strategic plan, but just something that came up for me.
Thank you.
Commissioner Gordon.
Yes, thank you, and I enjoyed very much our conversation. I think there's three things that I'd like to see come forward. Number one is the whole question of access to services. I think we have services. We have funding for the services, even separate from the First5 money. I'm not sure we make it easy to access the services, and that there are many ways to do that. Just a recent experience, I won't describe it in detail. Sometimes we're very rigid about the places we will offer the services in, to the point where we say, well, if we don't have this setting or whatever, it isn't going to happen. So that's number one. Number two is who is helping broker people getting the services? Do we have the right people in the room or on the ground to be able to make people feel comfortable in accessing the services, particularly with mental health services, so it doesn't seem like a forbidding thing to touch or whatever. And then the third thing is, when I look at all of these trend reports and all of that, I just wonder, from the standpoint of prevention, what are the things that we should not be compromising on? So if 30% of young people aren't getting the screening or whatever, should we be tolerant of that, or should we say, no, that's not okay? 30% not getting it is just not okay. And if it's 3 things or 5 things, maybe get some consensus about which things people think those should be, that we're going to try to make absolutely sure from a prevention standpoint. And then I'll just add one other one that's come up as a frustration, where we've worked on some of these programs and bringing them into alignment with the schools. The dental system and the medical system, they operate with completely separate delivery systems. So now it turns out a lot of the dental procedures or the dental things are preventative. So if you don't have fluoride, you can get a dental sealant. Okay, to me, a dental sealant is going to prevent lots of infections. So it could just as well be a medical intervention, but the medical people won't touch paying the $40 for a dental screening, and the dental systems don't always have people signed up for them. So I think if you could prevent a couple of infections for $40, you'll spend $40 talking about how you can't deliver. So I think the dental versus medical, I think for the preventive part of it, really would be worth rethinking, because I think we could do a lot there just by doing some of these simple low cost things. So.
Great, thank you. Commissioner Kothari.
Great, thank you. I appreciate all of the commissioners' comments actually here, but I wanted to lift up another thing that a lot of us have been actually speaking about, and I know Supervisor Cerna spoke about it at a board meeting recently, but that's about CBO, community-based organization capacity and sustainability. And I appreciate the work that Julie and First5 have put into really looking at that, and would like us to continue to lift up how do our CBOs need to strengthen and grow and become sustainable into the future to actually do the work that we're asking them to do in a successful way. And these are organizations, not only our go-to organizations, but these are organizations that are doing great work in the community, but really don't have the capacity to get a county contract, for instance, because they just don't have the infrastructure. And so as we're looking at this and looking at the strategies, if we could also really think about how do we need to strengthen capacity for the workforce in addition to the community-based organizations. So thanks.
All right, great. Thank you. Well, there's some more input for you. So,
Thank you.
again, appreciate all that you're doing. I think you're asking the right questions, and I too appreciated the hour that we spent together via Zoom to probe a little more in depth, at least at that point, just with me, my impressions of what the strategic plan should look like and its general architecture. And like I said, I think the questions you've carefully considered asking us, and certainly more importantly asking those that we serve, was going to provide us with a great 3-year guidepost in terms of how we fulfill our mission. So appreciate all your work.
Thank you.
Thanks.
And if we were on Zoom, I would have been giving like the thumbs up and the hearts to all of the
Yeah.
commissioner comments right here, because these are definitely things that we've been talking about in-house. And to hear that you're absolutely on the same page is really great. I think it's going to be for some great conversation and decision-making coming up. So thank you very much for joining us today. You got to hear a little bit about the process of their qualitative data that they're gathering. And Jordan is here and is going to step back in to do a relatively quick download for you on the quantitative data side, because I think you need both to be truly data informed. So
Okay.
I will turn it back over to Jordan again.
Great.
Hello, me again. So I'm here to present 2 pieces that I hope will be a point of reference for you during your strategic planning. The first is a racial equity snapshot, and I just wanted to go through, this is just the executive summary, but you have the full document in your packet. And our goal with putting this together was to sort of decrease potential gaps in knowledge that are unintentionally created by services in the county who share their results that may be very exciting and very impactful, but only reach their specific audiences. So we wanted to, ASR specifically has the pleasure of working with multiple systems in this county, and we see the exciting results that are being published, but not necessarily being all brought together in one place. And so we wanted to be able to synthesize findings from a select few community organizations that are focused on children and their young families, to give an idea of potential lessons learned that can help inform racial equity initiatives in this county or in other counties. This also aligns with one of the strategic plan items in the prevention cabinet, of which First5 Sacramento is a part, and I know many of you are a part of separately as well. So the first thing that we really wanted to point out is the idea that systems change comes from having a shared vision among all of those who are part of the system. Actionable insights, which is what we hope we are providing, at least in part, through this document, and then targeted resources, which will be the majority of the strategic planning process, deciding where to put funding. We want to highlight in the blue square that you see on the document just a select few disparities across the systems in Sacramento County. There are many more, but these directly relate to the initiatives that we are talking about in this snapshot. And so this is between African American families and whichever racial group had the lowest levels of these selected indicators. So for example, Black African American children were 9.3 times higher to have a substantiated allegation rate. These are baseline numbers, so before programming began, before, for example, the RAACD initiative began, which I know all of us are very familiar with. So we are focusing on, in the yellow square, the different initiatives that are targeting racial equity specifically. And again, these are just a select few that we were familiar with the results and were able to have data provided for us. So we focused on the RAACD initiative, which all of you should be familiar with from First5's active funding of that. The CAPC program, which funds the Birth and Beyond Home Visiting Program, as you heard about earlier today, and the Child Safety Forward Program initiative, which is a 10-year plan to reduce child abuse and neglect deaths. Also, we focused on the Department of Public Health programs, which include Black Infant Health, Nurse Family Partnership, and the African American Perinatal Home Visiting Program. And then finally, the Department of Child, Family, and Adult Services, CPS Cultural Broker Program. And I'm going to see if, can we go to the next page? Oh, there we go. So these, again, are just a few highlights that we wanted to draw your attention to. On the left is the county-wide changes that we have seen in differing domains. And on the right are highlights from the specific initiatives that relate to those domains. So the domains that we pulled out just for this executive summary are birth outcomes, infant mortality, and child welfare. The first, birth outcomes, I want to specifically highlight because the county-wide numbers are actually trending in the wrong direction. So we're seeing an increase in disparity gaps for healthy birth weight, full-term birth, and any breastfeeding. However, the public health programs that are actively targeting this all had positive outcomes, more positive than countywide rates. So this really gives an impetus to continue to make sure that these programs are able to receive funding and even expand if possible because of their positive results in this area that seems to be overall decreasing or worsening. Regarding infant mortality, the sleep-related disparity gap, perinatal causes, deaths disparity gap, and child abuse and neglect disparity gaps have all decreased. We hopefully are familiar with these very positive results because of our RAACD work. And speaking of RAACD, that program for the Pregnancy Peer Support Program that RAACD funds, they had substantially lower infant mortality rates compared to countywide, 3.5 compared to 9.0 per 100,000. And then also CPS involvement is also decreasing for African American children. So we can see when we look at the first page, the baseline had very, very large disparities that were extremely negative. We have seen decreases over time in substantiated allegations and the disparity gap, as well as removals from home and the disparity gap for removals from home. So we're seeing very promising results here, and I think some of the lessons learned that I did want to point out to you, which are in the orange at the very bottom, include maintaining a commitment to culturally responsive programming. We've discussed that a little bit even at this meeting today, rather than standardized one-size-fits-all approaches. Intentionally including community voice in programming. Again, I'm very happy to hear that that was brought up for the strategic planning process, and very giving a lot of credence to that rather than just being able to check the box and saying that you included community voice. Also being able to share results to be able to potentially scale up initiatives. For example, the public health programs, as I mentioned, are doing really, really positive work and could have a good place to be scaled up. Also, I just want to give a shout out to how Sacramento County has so much collaboration within the county, and just using the prevention cabinet as one example of bringing together multiple leaders from different systems that all have a common goal, in that case, preventing and reducing child abuse, really helps to then create long-lasting and overarching systems change. So in the event of time, I'm going to ask for any questions on this, and then I can switch to discuss the trend report as well.
Okay. Commissioner Wirtz.
Just a quick comment. I thought the recommendations are were well developed and are very consistent with what we've just heard around the strategic planning process. So I appreciate that.
Thank you.
Commissioner Gordon.
Yeah, I was going to say this later as a comment, but I just want to express appreciation around what you just talked about to Chair Cerna and the supervisors and Siobhan and Michelle and the people in the health department for the incredible level of collaboration that we have here. I think that's not called out nearly often enough. It's a big county, it's complex work, but I know just from the work we've done together, we've made enormous strides just due to the level of cooperation and collaboration, Dr. Quist and so many others. So from the education side, we appreciate it tremendously.
Likewise, definitely a two-way street. So thank you. Okay. All right. Why don't you move on to the next portion of your presentation?
Great. So now I'm going to talk to you about the Sacramento County Trend Report. If you are a commissioner that has been here a while, this should look relatively familiar to you. We take all of the different current result areas that First5 Sacramento has for their report, and we look at community level indicators, specifically Sacramento County, that could play a role in the overall trends. And before I go into the different results, I just wanted to talk about how we highlight the trends. So we look at 3 different components. We look at the countywide trend over time. So are we improving, either increasing if that's the positive or decreasing? The state comparison, how does Sacramento County compare to California as a whole? And then the size of the disparity. So taking the group that has the best current outcomes and comparing that to the group who has the worst current outcomes to see the size of that disparity. And the specific calculations that we do for each of them are listed on each gray bar in case you have any questions about that. We also rate each of the different criterion based on a red, yellow, and green system so that it's easily understandable when you look at a large amount of the indicators to know how each indicator is doing and in a standardized fashion. I also want to note that this is a Tableau dashboard. We've presented Tableau dashboards for the First5 Sacramento annual reports as well. The thing that's exciting about Tableau is that they're interactive, so you are able to click and change with which race or ethnicity you're interested in or which year you're looking at. So we're excited about the added functionality there as well. There is a PDF version that you should all have in your packets that is obviously static, but if you go to the website, you can interact with the Tableau. I am going to spend the majority of my time, sorry, this mouse is temperamental. I'm going to spend the majority of my time on the highlights page, which provides the red, yellow, and green ranking for each indicator that we explored. However, if there is interest or discussion about a specific indicator, I'm happy to click on that result area, which will bring us to more detail about each indicator. So I also have here with me a couple of interesting trends from the last time we did the trend report, which was 3 years ago, so that I will note if anything has changed in a significant manner for specific indicators. The first one that I want to draw our attention to is the very first indicator. You can see that infant mortality is still a pressing problematic area in Sacramento County. We have red for both the county trend over time, the state comparison, and the disparity among racial groups. Unfortunately, this indicator has moved from yellow to red from the last trend report for both the countywide trend and the size of the disparity. So we are getting worse over time, unfortunately. I also do want to point out from my last conversation about the racial equity report that the Pregnancy Peer Advocate Program, which is funded by First5 Sacramento, has had very positive results in this area of infant mortality compared to the county, and may be an example of a situation where we would be able to scale that type of program up, especially because it focuses on Black mothers. So the next line, which is low birth weight, and I promise I'm not going to go line by line, but there are a couple interesting things right in a row. Low birth weight, which we see is yellow for county trend and disparity, and green for state comparison. The state comparison, when we had this 3 years ago, was red. So we have gone from red to green in that domain for that indicator. The county trend for our last trend report was also red and is now yellow. So we are improving in the low birth weight category, even though it still does deserve more funding and looking at. The other one in this section that I wanted to sort of draw your attention to was access to prenatal care, which in the last trend report, the state comparison was a yellow and is now a green. So we have improved in that area as well. Scrolling down, looking at breastfeeding, you can see that exclusive breastfeeding at 3 months is better across time in Sacramento County and is also performing better than the state. It is also performing better than the state for in-hospital exclusive breastfeeding as well. The third result area looks at medical, dental, and mental health services. I do want to point out that, unfortunately, there is a lot of red when you just scan to look at the state comparison. Many of these measures are new to this trend report for the ones that are indeed red. So prenatal and postnatal depression, before that was a combined measure with anxiety, ACEs, children with 2 or more, and adults with 4 or more, mental health needs, and then if mothers have had a postpartum visit. So you'll see that we do not have race or ethnicity data for quite a few of these indicators, which is why there's the little light gray X, and for any of the ones with the solid gray circle, that means that we only have the baseline measure, so we can't look over time. But I do want to draw the state comparison to your attention with those many different health and mental health related fields. Okay, moving to the fourth result, second goal area, which has to do with childcare and being ready for kindergarten. So unfortunately, race and ethnicity data has largely not been available for these specific Sacramento County indicators, but I would like to draw your attention to developmental screenings, which the state, Sacramento is performing at higher levels than the state. The children who received a developmental screening in their first 3 years of life, even though we have decreased in how many we have given as a county overall. Special education enrollment has also decreased in Sacramento over time, but overall is performing better than California. And early literacy, which is a First5 measure, so this is not community-wide, has also decreased over time, so those who are read to at least 5 days a week. I also want to make sure that I note one point that was not listed on this trend report, but is also important, even though it isn't necessarily directly about children who are aged 0 to 5. The California Department of Education has released information about third grade math and English scores, which we know are highly predictive of later school success. And they split it out by children who were socioeconomically disadvantaged and those who were not socioeconomically disadvantaged, and also by race. So first, I'll talk about the socioeconomically disadvantaged. As As anticipated, children who were socioeconomically disadvantaged were less likely to meet or exceed the state average levels for math and for English in third grade. And then it was also evident by their depiction of different racial categories that racial inequities exist in our county as well, with Black/African American children scoring the lowest in both math and reading English levels, regardless of socioeconomic status. So they were the lowest performing race in both of those categories. And so that really provides strong evidence that more funding needs to be taken into account that pinpoints not only socioeconomic status, though that is important, but also race and potential racism at the structural and institutional level. I am going to continue on to our final result, which is all about CPS. So we have CPS allegations, substantiated allegations, and then recurrence, so re-entering into the CPS system with a substantiation. All of those trends are performing positively over time in Sacramento County, which means they are getting better, so they're decreasing. The state comparison, Sacramento is still higher than California for both allegations and substantiations, although recurrence is performing better than the state. And there are still high levels of disparities in allegations and substantiations, although the disparity gap is in fact decreasing over time, even though the disparity as a whole is still quite large. So I know that's a lot. That's a ton of information. I also know that we are at time for the meeting. So I'm opening this to questions or discussion, and I'm happy to go to any of the specific result areas of interest.
Great. Thank you, Jordan. That was excellent and very thorough as usual. So turn to commissioners if they have any comments or questions. We'll start with Commissioner KS.
Thank you, Jordan. This is great. Can you scroll down? I just had a question about the CPS.
Yes.
Okay.
Oops, sorry.
Right there. So allegations. So substantiated. Oh, okay. That's the initial substantiation of maltreatment.
Yes.
And then the substantiated recurrence is also of maltreatment.
Correct.
Okay.
Yes.
Thank you.
Great. Thank you. Commissioner Wirtz.
Just a comment. I think that the Tableau format is actually very cool. If you go on that, you can go over, any of those dots light up with further information on how to get to and where those are. So I think I would recommend that we have when we're doing strategic planning, if we're ever referring to this, that we actually have the online version available to just access the more detailed piece. And just in general, it's good to see these indicators, but these have all kinds of caveats around each of the indicators. I think I had pointed out that I think that one of our other reports shows a negative outcome, whereas this is showing a positive one, and it's partly due to the time frames and so on. So I just want to keep us cautious about not taking this as the definitive answer on any particular thing without further looking into it in a little more detail. But I look forward to using it. And as I said before, I think there are some other indicators that would help us determine whether we're responsible for these trends or whether there's forces that are broader and are substantial in the community that are affecting these, and that we need to take that into account, like you've done, where a rate the trend may be going down, but our programs are showing positive impact, and therefore we need to look at scaling up and what policies and systems changes can be made in order to make those changes more systemic and long-lasting. So,
exactly.
Thank you.
Thank you so much for bringing that to everyone's attention, Commissioner Wirtz. I mentioned that they're interactive, but I think it's a good idea to actually show how if you scroll over any of the any of the bars, they do pop up with the actual number. And then there are also the breakdown of race and ethnicity, whenever available, is also listed on each specific page.
Very good. All right, any other questions for Jordan? I think that's it.
Thank you so
Great.
much.
Thank you, Jordan. Just one last check to see if there's anyone that has signed up to speak on this item.
No, sir.
Okay, very good. All right, that brings us to our 11th and final item, which is commission member comments. Looking to my right, any comments from commissioners? No? My left? None? All right. If there is no further business then, before this commission, we stand adjourned. Thank you, everyone.
Thank you.
Thank you, everyone.